I think, Phil, we can start with you. We obviously just saw the sizzle, but tell us and the audience a little bit about founding Project Healthy Minds and what your intention was when you decided to go on this venture.
Yeah. Well, just a quick show of hands. How many people here have ever used OpenTable or Resy to book restaurant reservations? Okay, everyone. Has anyone ever used Expedia or Kayak.com or Cheap Tickets to book flights or hotels? Okay, all online aggregators, all marketplaces. We have them for everything in our lives. But there had never been an equivalent online marketplace for finding mental health services in America. And yet, you have 65 million Americans with a mental health condition. 60% of them never get any form of care in their lives. And the two big reasons why they don't is because of the stigma and because it's hard to find help. And so 6 years ago, I was sitting in New York. At the time, I was at BlackRock. I was the chief of staff to the vice chairman. And I was at breakfast with two friends of mine who manage a bunch of musicians, one of whom is the hip-hop artist Logic. And I don't know how many people here remember Logic's 1-800 song, but it came out in April of 2017. The title of the song is the phone number of the suicide hotline. And the song is about his own struggle with mental health. That song went 7 times platinum. It was nominated for 2 Grammys. But perhaps even more importantly, the day that song was released, the suicide hotline saw the second highest call volume in its history behind the death of Robin Williams. A few months later, he performs that song at the VMAs. There's a 50% spike in call volume. Then he performs it at the Grammys. There's a 300% spike in call volume. And years later, there were studies published about how many lives were saved. And so Chris and Harry had told me this story, and I was on a different career path, and I was like, wow, there are so many people who could use help. And the lesson of the song is the power of role models to inspire people to seek care. So that's how it began.
Right, and Jody, you're on the board of directors, obviously. Tell me a little bit about what intrigued you about this initiative, and how has mental health and destigmatization become more of a priority for you over the years?
So I grew up in Philadelphia, and my father and grandfather had a nightclub. And so I watched, as a little girl, I watched artists going from their dressing room to the stage. Some artists threw up, some artists shook, some, I saw as a little girl that artists were different than me. I was very grounded, also had to be the grown-up always, even as a little girl, but I watched them. And when the curtains, rose, they became a different person. But I was more interested in who they were, and so I had always wanted to be in music. I ended up in the music business. But the thing for me is that I do recognize, to be an artist, there's this thing, there's the mental health and artistry go hand in hand, or the lack of good mental health. And I think it's part of what make artists artists. And so for me, having relationships with artists and seeing what's going on and noticing that so many artists are speaking out, I wanted to do something. I had met Phil. Phil gave an amazing presentation at a friend of mine home, and I'm like, I love this. And he said, will you join the board? I said, I don't have time. And then he asked me again, and I was like, how could I not do this? Because I can utilize my relationships with talent to help bring in young people, all people, to get the help that they need. And I think they look up to the artists that they love. And I think it's a great thing that artists are speaking out. And I think that's where I can be helpful. And I really believe in Phil.
How have you both seen attitudes towards mental health shift in the music industry over the years? Obviously, it's become more of a priority for artists to speak out and speak about their own struggles with it. But how have you seen it across the board, not just on an executive level, but also on an artist level?
I think that, it used to be artists had drug problems. And we thought they had drug problems. And I think you realize that that wasn't at the core of it. It was self-soothing and whatnot. But I think that there's a whole level of artists now who don't go the distance, don't need to be superstars because they have to take care of their mental health first. And there are a bunch of artists who recognize what their limitations are and are going, you know what, that's too much for me. I can't do that. It's not good for my mental health. And I think that's the change that I've seen. They're outspoken about how they feel you know, and I think that that's going to change the way people see mental health and how they're treated.
Phil, I want to ask you, obviously, technology plays a very big role in the work that you do, and I'm curious some ways that you've utilized technology to sort of spread mental health awareness and make it known not just to artists, but to their fans and people who are across the world, that they can access mental health initiatives and help through technology.
Yeah. Well, it's interesting. The historical model for how artists and the media industry have addressed this issue is, think about like a traditional TV show that has a mental health storyline. At the end of the show, there will be an end card that says, if you're suicidal, here's the phone number, the hotline. And it's amazing that media companies do that. But there are 50,000 suicides a year in the United States. There are 65 million Americans living with a mental health condition.
Say that number again.
50,000 suicides each year. 65 million Americans living with a mental health condition. It's 4 times the number of people diagnosed with cancer in this country. And so if the call to action is only a suicide hotline, it's very important, but it doesn't serve the entire audience of who's watching that show or who's listening to that music or who's following that musician on social. And in our case, you don't have to choose between the suicide hotlines and finding a therapist or finding an eating disorder service or finding a psychiatrist or a support group. Our whole vision is there should be a front door on the internet for finding mental health care where all the services are vetted by clinicians and the platform is free for the public to use. And so if you think about it in that way, across the whole entertainment ecosystem, whether it's traditional broadcast TV or theatrical releases, whether it's in live music, whether it's on YouTube with music videos, or just social content that's not even serialized. 9 times out of 10, when people sort of are storytelling around mental health in some way, they want to have a link to services, but the only option that people had before ever was like a suicide hotline. And the pain point when you talk to people who work in this business is they'd say, I know it's not perfect, but it's the best that I have. And so that's the way that we've been doing it. So we've partnered with folks like Demi Lovato on Child Star and the Kid Laroi on his docuseries. So there's a whole set of folks, and there's a lot of ways that we work together. But to me, a lot of musicians have said to us over time, this issue really matters to me, and I know it really matters to my fans, and I know that my art is a way that I can inspire people to seek care. How should I do that? And I told Jody when she joined the board, 2 years ago, or 2.5 years ago, Jenna Ortega posted on her Instagram story, one Instagram story post. We didn't know Jenna's team at the time. We had no existing relationship, but she was passionate about mental health. She wanted to post about mental health. It ended up breaking the 2-day record of traffic to our platform. She wasn't even in the content, but it just goes to show the power of any role model to use their platform to make a difference.
And Project Healthy Minds has a tool that you use to sort of help people to get mental health services. It's the mental health marketplace. What can you tell us about that and how maybe artists have directed people towards that, and how you've sort of created awareness around this tool for people to get help with their mental health?
Yeah, so, if you take Demi as an example, right, last year she had the Child Star project, and at the end of the show, and then in all of the social promotion around it, whenever they would talk about mental health, the call to action was go to projecthealthyminds.com, and then we would create a co-branded version of the marketplace with the artist, with whoever the studio is, so that it fits their visual identity system. And so the idea is to be able to show people and show fans that artists and entertainment companies are partnering with Project Healthy Minds to help connect people to care. And the amazing thing is we can see all the data. So we see every time I get notifications, my inbox totally blows up. Every time we do one of these partnerships, thousands of people start seeking care immediately, and we see, well, what kind of care are they searching for, and what do they need? And to us, it's an amazing way to see the impact. A lot of people say, who are in the public eye, when I speak publicly, I know that it makes a difference because people come up to me and talk to me, but I never have data around it. Well, in our case, we actually have data around exactly the impact they're having.
What do you envision as the future, or I guess the evolution of technology in order to help people gain access to this sort of thing? Are there areas that you were exploring? Do you find that people are gravitating towards certain initiatives that you're putting in front of them? How is the future going to evolve hand in hand with technology?
Yeah, well, it's a good question. One of my frustrations, so I spent 10 years at BlackRock, very different career path. And a decade ago, there were 5 of us who were assigned to stand up what was then called the impact investing business. And so one of my great frustrations is, I don't think that technology solves every social issue. I don't even think it solves a majority of social issues. But I do think technology can be used to solve more social issues than it does today. This idea that all of the best entrepreneurs and all of the best, creative minds are only using technology primarily to help get your attention just seems upside down for this country, and that what we ought to want is an ecosystem where people are using technology to solve all kinds of social issues, not just mental health, all kinds of social issues. But you can't be what you don't see. And so you need examples of people and groups of people and organizations and people like Jody who are willing to say, you know what, I do believe that technology should be used for good, and I'm willing to help make this project work, because I believe that when my kids grow up, I hope they live in a world where technology doesn't just help you serve an ad in a more precise way, but I hope that it also helps young people find the mental health care that they need.
Can I ask one thing?
Yes.
Because one of the things that's in the news is about people getting therapy on ChatGPT. How do we send them to Project Healthy Minds and not ChatGPT?
Well, it's a great question. Look, our
Sorry.
view.
Fine.
I didn't know.
Keep going.
Okay.
Our view is that it is way too early to know exactly how this will play out. So in Illinois, about 3 weeks ago, the governor just passed a law banning the use of any of the AI chatbots as a replacement for a therapist. And I'm sure if any of you are parents, you've read the stories in the New York Times and elsewhere over the last couple of weeks about parents who have lost kids to suicide. So we're not anti-AI at all. But I do think you have to figure out what is the right use case for it, and that's what we're spending a lot of time on.
Right. Obviously, you have brand partnerships. You have artists partnering with you to get the message out there. What other sort of initiatives is Project Healthy Minds taking? I understand there's a gala coming up coinciding with World Mental Health Day. So what can you tell us about that?
Yeah, well, thanks for the tee up. So 2 weeks from today, you know how there's like Pride Parade for LGBTQ plus rights and Race for the Cure for breast cancer? There was no equivalent flagship in-person event for World Mental Health Day on October 10th each year. They've been around for decades. It mattered in the mental health community, but it didn't matter more broadly to people. My argument is that COVID mainstreamed the cultural relevance of that day. And so for us, if we're supposed to stand for making it cool to talk about your emotions and to seek help, then somebody has to create some flagship festival for World Mental Health Day. So we're now in our 4th year. We produced the largest festival in the world for World Mental Health Day. It's in New York. We just announced this morning that the Duke and Duchess of Sussex, Prince Harry and Meghan, are going to be attending this year. And if any of you afterward are interested in being involved, just like every other issue has its moment in the sun, we need one of those for mental health.
Last question is, how are some ways that people here can get involved with your cause and help spread the message?
Well, they can email me at phil@projecthealthyminds.com.
Write that down.
Yes. No, look, we need all of you. There is no way, one of the great challenges of building a tech-driven nonprofit is, if this was a for-profit, if we were a consumer tech startup, you would have a massive marketing and advertising budget to go from, we've already served 400,000 unique Americans, but we want to be serving millions. And you'd have this massive marketing budget that would help you get there. As a nonprofit, we will never have that. That will never exist. And so the strategy question that I face is, How do I go from serving hundreds of thousands of Americans a year to millions when capital is the constraint? And my view, my answer to that is everyone that's in this room and people like Jody Gerson. We need people across the entertainment landscape to partner because you all shape what Americans see every day and who they look up to and the stories that are told. And those stories are not, unimportant. They are the difference between someone finding life-saving care or not. And so it doesn't matter what role you're in. I would love to talk to you afterward.
Great. Well, thank you, Jody. Thank you, Phil. Everybody give a round of applause for them.